So I'm Kathleen at the Worker Institute and co-director of the NLLI. And some people watching probably don't know you, Tanya, so maybe you could do a quick intro of yourself.
Sure. I am Tanya Wallace-Gobern. I'm the Executive Director of the National Black Worker Center Project. We are a network of 8 Black Worker Centers across the country who work to erase racism and discrimination in the workplace and workplace practices and policies.
Excellent. It's so good to see you. I feel like what happens anytime I encounter someone from our NLI family, which is like, I just have such a warm heart and so appreciative of having gotten to know you. How are you doing? Like, how are you? How's your family? How have you been experiencing this last couple of months?
Yeah, I'm well, thank you. We are all healthy. Knock on wood, no one in my immediate family has been impacted, but I think that similar to what most people are experiencing in this country and in the world, COVID has gone from being something that you read about in the paper to hearing stories of people who tested positive for the coronavirus in your community, in your neighborhood, in your city, to actually now knowing people who have tested positive. And sad to say, I actually know people who passed as well. And so I am thankful for every day that I wake up. I am terrified when I think about the so-called leaders in our country and how they are misdirecting what's going on. And so I'm just on a roller coaster. I'm up and down.
Yeah, I feel that way too. I feel like someone I spoke with this today, probably, I said it's a combo of deep gratitude and total rage.
That's right.
Well, one thing that's just unavoidable, I see we have Paul Cameron and Vonda McDaniel watching us. Hi, you guys. It's just unavoidable to face the reality that communities of color and Black communities in particular have been hit by this crisis in a way that the other communities haven't. And living here in Milwaukee, I can tell you that a majority of the deaths, or a huge number of the deaths, have been people of color, and very prominent. My own state rep, who's an African-American man, was in the ICU for, I think, 10 days recovering. And so, we've heard stories of community leaders and, pretty prominent, beautiful people who've been part of the African-American community here who've been taken by the virus. So I'm just curious, as someone who's so deeply connected to the Black worker centers in 8 cities, what are you hearing, and what are you seeing that you would like the rest of us to know and understand about how this is affecting Black communities?
Sure. I think that the first thing that we see that's being exacerbated is the reality that Black workers face, where Black workers face this racialized political economy where they're exploited because of their race and their class. And I say that because it really connects for us to this whole term and theme of essential workers. We believe that the individuals that we call are now essential workers have always been essential workers. They are the workers that have been responsible for a lot of the comforts that we have experienced and come to take for granted. And I've been saying this to a lot of people, so I'll say it here as well. At the Black Worker Center, we find it extremely ironic that the same people who we have battled for tooth and nail to pay $15 an hour are the exact same people who this country is dependent on for our most indispensable needs. And these are the people that are underpaid, undervalued in our society. And as I said before, most critical to our daily survival. And it's not just because of COVID-19, they've always served this role. And our society has taken their work for granted. Because of who they are. These are women. 1 out of every 3 women are essential workers, and it's because they are people of color. And we deem them, our society has deemed them as less deserving. And one of the things that I want to share that we are seeing is that hasn't come out in the media yet is this backlash against essential workers. And the way that it is being phrased is that some people in the white community feel that because Latinos and African Americans are predominantly seen as essential workers, that somehow the narrative is that they must be not essential and that they're just lazy and sitting on their butts, right? And
Mm.
so we're seeing a bit of that backlash, which is compounded by the fact that when the virus first started to circulate through our community, people had to fight tooth and nail just to get the protective equipment that they
Yeah.
needed. We talked to workers, for example, here in North Carolina, where I live, who were at Walmart, who instead of being given protective gear, were given gift cards and told that they could just buy it themselves, things like that. And so while some of that is improving, the fact is that people are having to make very hard decisions. We've talked to workers who are torn between leaving their children at home by themselves because school is out or going to work. And so these are the dynamics that Black people have been facing even prior to COVID and corona and the coronavirus. The other thing that it points out for us is that it's frustrating how quickly this country has been able to mobilize around this pandemic. And we would say that our country has been in a similar pandemic where am I still on?
You're still on.
Okay, I just got a notice saying that I was signed out. I'm sorry about that.
You're okay. Yep, that's all right.
Okay, so we would say that racism in this country is a pandemic, right? It's a virus that is spread through. It has killed countless amounts of people. It has put countless amounts of people at a disadvantage, and it needs to be treated as such.
Yeah, I've been thinking a lot about all the layers of how racism operates. And so you have the lack of access to healthcare. You have the, stories of Black workers who've gone to the hospital and been turned away or couldn't get a test, or their complaints aren't taken seriously. And then you have all the risk that people are asked to take at work. And at every level, of course, like Black workers are put in a position that's much more risky and much more difficult to navigate. Is there like a particular worker story or a particular family story that you're really carrying with you as you do your work?
So there's a body of work that we're going to start with the Black Worker Center that we're calling the We Ready movement, and it stemmed from one of the things that we were planning on doing, as I'm sure a lot of organizations were, was work around the census. And we had a street team that was, prepared to go, and we were doing census pop-ups to allow people in undercounted communities to come and take the census if you didn't have access to a computer, internet, etc. So we weren't able to do that, and we decided to switch our operation to phone banking, and not just asking people if they've taken the census, or if they needed help taking the census, but to ask them how they were doing and if they were working, and if they had any concerns or questions about COVID. And we were surprised at the types of questions that we were getting, and it became very clear to us that the ways that that protections were being communicated by the ways that people in the media talk about health precautions were not resonating with everyday people. So on one particular day, I'll just give a couple of different stories, but on one particular day, there was one woman who we talked to who asked if she should cash her stimulus check because she had heard that, that there would be a lot of taxes associated with it and she would have to pay that money back. And we heard that story over and over again. We heard stories of people, asking, should you bathe in Clorox? Should you not bathe in Clorox? Not identifying with the term upper respiratory problems and saying, but I think I'm clear because I just have sugar, right? So not really being able to have anyone that was communicating directly to Black people, even though in the news there was just stories, and we were inundated with these stories about dire stories of how the Black community was being impacted, but no support for the Black community. And so when we were doing our kind of just check-in calls, that quickly turned into a need for us to translate what was being said in the media so that people understood how it impacted them. And what we've decided to do is to create a 1-800 helpline so that Black people can call in, get their questions answered about how the virus is being impacted, how it impacts them, excuse me, and to provide a bit of political education so that people can understand how we got into this moment and what we can do to get out of it. And
So
by this moment,
crucial.
I mean this moment of extreme systematic racism and how that permeates everything that we are seeing today and what we need to do to get out of it.
Yeah. I feel like the situation with the partial reopening, full reopening, all the protests is pretty terrifying. And it's, I mean, that's scary to me. And I'm sitting here in my home in Milwaukee where I'm actually pretty safe, generally speaking. And so I have to think that for the communities that have experienced the worst of the, more cases, more sickness, more deaths, that's got to be even more so. And I'm just curious, how are you guys thinking about reopening? What does it mean for your communities? And what would you want policymakers to be thinking about when they're making these hard choices? If they were to have your people in mind, what would they be doing?
Mm-hmm. So, Kathleen, when we talk about reopening, we have to be mindful that the conversation around reopening is wrapped in this conversation of returning to normal. And this returning to normal is lifted up with this nostalgia. And the reality is that the racism, the discrimination, the disregard for worker safety, for worker voice, for fair compensation, that should have never been seen as part of business as usual or normality. And so that's one of the first things that comes up for us. There is a tremendous amount of concern on the emphasis of returning to work or back to normal to get people of color, these essential workers, back to work, right? Back to these conditions where they are not being paid a fair, decent, and equitable wage, where there are no provisions for their health, no protections for them. That's what has to end. And that's those are conversations that we're having in the Black Worker Center, that we can't go back to normal, that we really have to take advantage of this moment, to leverage this moment with bold leadership. So that's one thing that's coming up. The other thing that's coming up is just the reality of being either even further exposed to people who potentially may have the virus, and bringing that back to your home and your community on a regular basis. And so there still is there's a necessity for protective equipment. There's not enough of it. People are trying to, makeshift their own equipment. There are provisions across the country that say that it's mandatory for employers to provide this equipment to their employees. Again, I'm in North Carolina. We heard, even before it got picked up on the news, we heard the conversation. I had conversations with the workers in the slaughterhouses, at the chicken processing, poultry processing plants, about people who were coughing, right, who tested positive, but had to keep working because they needed to work. And so just add on to that. So that's the normal world that we live in now, where fewer people are exposed to that. And to just imagine hundreds of thousands of more people being put into that environment and to that population is frightening. And we have no way of, no reason to believe that there will be anything other than more death in our future, more deaths in our future. More
Yeah, it's
illness.
really speaking to me about how this is highlighting how important it is for workers to always have a voice and a choice, and to know that if they refuse to go to work because it's not safe or healthy, that they're not going to be retaliated against and they're not going to lose their benefits. And that's not a world we've lived in up until now. So that's got to be the vision of the better world we're going to create coming out of this. A new normal, that is the real, where there's real justice and real power for working people.
It also assumes, right, that people have benefits that they will be able to retain. There's also the population of people that were unemployed, and we know that African Americans are experience disproportionately higher levels of unemployment than other workers, and so that also is problematic. We can't help but take note of the expectation that African Americans and Latinos will experience a tremendous amount of layoffs as a result of this as well. So
Right.
we would imagine to have tremendous disruption in our communities, layered on the disruption that already exists, right? So specifically thinking about gentrification, right? So if you're not working, especially in this moment, how will you maintain your household? How will you pay your rent? How will you pay your mortgage? That means that you have to leave. And when people leave their communities, we know that they are pushed out further from the city where they have less access to public transportation, which means that they will have less access to a quality job.
Mm. Yeah, there's a possibility of us doing something amazing with the lessons learned. And then there's the possibility that we just make worse the dynamics that we have known, like that one.
Well, I think that we have to just roll up our sleeves and say that we will make the conditions and the possibility that we want to make. The plus side, I think the silver lining in all of this is the number of people that are impacted. And I believe that if we are organizing and working in coalition with one another to organize the unorganized, to ensure that all workers' voices are lifted up. Can you imagine right now if workers just said, if poultry plant workers just said, no, we're not going to go to work? What would you do about it, right? There's nothing that you could do. There are no other workers to stand in their place.
Right.
If all essential workers just walked off the job or stopped working for 15 minutes, for 20 minutes, for 30 minutes, the reality is provisions are being made for workers in terms of their safety equipment, not because companies decided or employees decided to do the right thing. They did it because of the outcry that came through our country, and that has to continue. We don't have the luxury of being afraid right now. We don't have the luxury of worrying about our membership, worrying about our declining membership, worrying about our structures and our infrastructure and our dues going away. We don't have that luxury. There's too much at stake. And I believe that if we are bold and lead with courageous leadership, we can create a worker movement like we have never experienced before. And that is the task that's before us.
That is a beautiful call to action. And I think that's a good place to stop for now. Obviously, we're with you, and I feel so heartened and so just strengthened and inspired myself by knowing your courageous leadership and what you're trying to do. And, the whole NLLI community is part of that fabric that we hope you'll draw on as you're building this vision. And it's just really inspiring and really great to see you.
Well, thank you, Kathleen. And let me just challenge everyone who is listening from NLLI and whoever else gets the opportunity to listen to this Facebook Live. I welcome, the National Black Workers Center welcomes this coalition effort that we have been discussing to really figure out what are our opportunities right now. Let's just dream big. What policies might we put in place to end systemic racism? This is our opportunity. And I know that united, we can create that. We can create that win, a real win that is lasting and has a far greater impact than any of us would have ever imagined.
That's perfect. Thank you so much.